Philanthropist, businesswoman, and advocate Melinda French Gates is here in New York this morning. Why? For the annual Goalkeepers event, which brings together leaders to address the world's most pressing challenges. So listen to this number. Every day, an estimated 800 women around the world die from preventable causes related to pregnancy and childbirth. That's about one death every 2 minutes. 2 minutes. This year's Goalkeepers Report focuses on life-saving innovations that could save an estimated 2 million mothers and babies by 2030. The Bill and Melinda Gates Foundation is committing $370 million a year from 2023 to 2027 to support maternal and children's health. Melinda French Gates, who is co-chair of the foundation, is with us exclusively on CBS Mornings. Good morning to you.
Hi.
Grandma. We'll talk about that in just a second.
Thanks for having me.
But I think the number is astounding, Melinda. When we think about this segment alone, by the time this segment is over, so many more women will have died. And they just don't have to. And that's one of the reasons why you were here to discuss.
Definitely.
What's your message?
My message is that these are needless deaths. I mean, this is an ancient problem. Women giving birth should not die in birth these days. By the time we're finished with this segment, 2 more women will have died. So it's as if you and I are gone and these guys are still sitting here.
But you say preventable, why and how?
They're preventable because we know what to do. And we are coming up with new interventions, and we can talk about some of those. But these are deaths that, you know, if we did the right thing when a woman is starting to bleed to death, if we did the right thing of giving her IV iron so she doesn't have anemia, these are women who don't need to die. And guess what? If a woman dies, it reduces the chance that her child will survive. In fact, the child's chances of surviving then are only 37%.
Did becoming a grandmother yourself change your perception? Listen, you were always compassionate.
I'm sure you're already into this, but seeing your own child become a mother must focus it in a new way.
Definitely. We've always been working on this as a foundation, but I think we've renewed our efforts. Being in that delivery room with my daughter and her husband.
You were in the delivery room?
I was in the delivery room, and you see the intense times, and I remember the intense times for me when I'm giving birth. And there's a lot of downtime where I could think about other places I'd been in the world in the delivery room where moms weren't going to survive, but my daughter was likely to survive.
Yeah, speaking of that, in your report, you note that Black and Indigenous women died 3 times the rate of white women. What was your reaction to finding that out?
I was shocked. And when I first learned that was only about 5 or 6 years ago when Serena Williams wrote her essay after the birth of her first daughter. I was shocked that here is this person who is one of the top athletes in the world, and she's not listened to in our own healthcare system, and we almost lost her.
And she's Serena Williams, and all that comes with
So
that.
think about the women without those resources.
Exactly, and those are the women that we lose in our country.
So
it shouldn't be.
It shouldn't be. So let's talk about how we make it not, right? With $370 million per year for 4 years, that's the commitment. How is that money going to be spent? Where do you think you'll see the biggest impact?
Well, we're coming up with new interventions that can save lives. We're working on getting the data to understand exactly where women die in the health system in the United States and around the world. And then we're advocating for policy changes that make a difference for women.
You also recently announced, I was really glad to see it, because last time we talked, you said, listen, I will stay on the foundation for 2 years. We'll see how it goes. Because we all know about the divorce with you and Bill Gates. You said, we'll see how our joint leadership goes, and then we'll each make a decision. You made the decision that you are staying on, so I'm thinking it's going well. So what went into making the decision that you will continue? Because this was your baby, too.
I'm a co-chair of the foundation. I'm a founder of our foundation. I care deeply in the things we're talking about today, moms and babies. So there's no reason for me to leave my post of an institution I created and that I'm advocating for. I'm meeting with presidents and world leaders while we're here in New York this week because I want lives to be saved, and this is the way to do it.
Speaking of saving lives, and since you just referenced it, this is not a new CD Walkman.
No, it's not.
Our new charger we have on CBS Mornings deal.
Yes.
So there are both interventions that exist today, like azithromycin, something we all use, but you can use that during pregnancy for mom. It'll save her life. But another new intervention we've come up with is an AI ultrasound that's being developed that, especially in these low-income countries, you could put it in a nurse or midwife's hands, a few swipes across a woman's belly, and they get the statistics of, is this child going to be in trouble? Is this child not gaining enough weight so you can intervene? These are new low-cost interventions we can get out into healthcare workers' hands to save lives.
Not a special phone, just a regular old phone.
Regular phone
Incredible.
with a little handheld device, not a big machine like you see where we go in the United States for an ultrasound.
Yeah.
This will save lives.
Yeah. Regardless of what we accomplish, sometimes I feel like we are looked at by the fruit that we bear. And I want to bring up your daughters, Jen and Phoebe. It seems like they're following in your footsteps.
Yeah.
So it seems like your life work has made a profound impact on your kids. How does that make you feel?
Fantastic. I have 3 children that I am so proud of. They're all in their 20s. They've spent a lot of time outside of our own country. They see the disparities in the world. And so to have one be a global advocate for women's reproductive rights and another who's in medical school, it makes me feel great as a mom.
You know what makes me feel great is seeing you. You are strong, you are proud. We just saw you on, they reference you on Billions as Melinda Gates in a very positive way to say you're a badass, basically. So life is good for you, Melinda, right?
Life is great,
You
and
are
I want to make
happy?
it better for other
Yes.
moms.
There you
And
go.
you are happy.
Melinda French Gates, thank you so
Yes,
much for
yes,
joining
yes.
us.
Thank you for having me.